Disclaimer: the content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now...
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
Ladies and gentlemen, Ben and Amy on The Heavy Truth.
Hi, I'm Amy.
And I'm Ben.
In this week's episode, we are going to talk about the chronic disease of obesity. This podcast is going to talk about obesity as a disease, the serious health risks associated with the disease, and resources and risks associated with the disease in itself.
Right, Amy, I think right away we should define, what obesity actually is according to what some of the people think experts are. So according to the World Health Organization, overweight and obesity can be defined as an abnormal or excessive fat accumulation that presents a risk to health. And so they utilize the BMI, or body mass index, which they say a BMI of 25 is considered overweight, and a BMI of 30 or greater is considered obese here in our population.
Yes, and then we can go a little bit further and talk about morbid obesity. But bottom line, anytime you have a BMI over 25, something that, clinicians should address, and people should be educated on the risk associated with having, being overweight or obesity.
Right. I think, obesity is one of those topics that every clinician, it's very difficult to discuss with their patients or with someone coming to see them, because I think it's a very sensitive topic to everyone, right? You walk in and you don't want people automatically, again, society, as we talked about in the last episode, has such a negative view of obesity or being overweight. So it's often a hard topic to discuss with people, whether, even if you're not just a provider, to discuss with anybody, your family, your spouse, your children, right? It's a hard topic to say because we see it everywhere, right?
Mm-hmm. And there is that obesity bias out there, and it's
Absolutely.
not just individuals, it's also clinicians, and they just want to avoid that topic altogether. And I see it a lot in my practice where patients will come in and they'll say, I was never told that I was at risk for anything.
Yeah.
And they had been overweight their entire lives, and now they have, diabetes or pre-diabetes or high blood pressure and a BMI over 40, and this is the first time that their doctor has ever brought it up to them, which is sad.
Which is
right?
very sad, and as I had said, as an overweight individual, I can remember going in to see my primary care provider, and we never, ever discussed weight. It was never brought up that at 16 I weighed, almost 300 pounds, and I was 5'11", and my BMI was so high. We talked about common, the common things. How are you feeling? How's school? How active are you? Things like that. But as I became older and became an adult, then blood pressure was getting higher and things like that. And so then we wanted to have that talk. But I saw, like you said, in my own practice, patients will come in and I'll say to them, I think the biggest thing is I say to them, what did you and your primary care provider discuss that brought you here to see me today? That's the first thing I say to them. And a lot of times they say, they just said I should come in because I'm fat. Or they come in because, I need to do something about my weight. It has never or wasn't ever addressed in their own practice.
Or they brought it up. I'm here because
yes.
I brought it up, because that is something I always ask. How did we come up? How did coming to see me come up in conversation?
Yeah.
And they would say, well, I have concerns about my weight, but their provider, clinician, whoever, they did not bring it up initially. So, there's definitely more education needs to be, more awareness even for
Absolutely.
primary.
Why do you think it's that hard? I remember when I was in school to become a nurse practitioner, one of the classes we were talking about interviewing patients, right? When we come and sit down and interview with patients. And my professor said that the number one thing that she found out when she was doing her rotations and also working with students is that topic of obesity. Do you find that it was a hard topic to discuss, or what made you realize that was a hard topic, or what have you heard about that?
Well, I mean, for me, of course, it's easy. I mean, I do it all the time, but when I would go to doctors' offices, again, they never would really say anything to me, but I dreaded getting on the scale myself, and I still have patients that hesitantly get on the scale for me, but that's why they're there. So we need to see what their weight is, but it's a scary thing. It's intimidating. And, it's just, I think it's the old school way, honestly. Some of the newer clinicians, they're more on top of it. I mean, they definitely don't have the background of still like the nutrition and the exercise. I still do get a lot of, just eat less and move more, and in future episodes, we'll talk about things like that too. But it's just their way of addressing it and then sending them off to a specialist, which to me, it's great. But at the same time, there's more awareness that can be had at the primary care level.
Right. I agree. Why do you think, in your opinion, it's difficult for a primary care provider to discuss a topic with their patients that they should? I mean, I read notes, as do you, right? And I'm sure everyone that's listening, when they go see their doctor, right? Their doctor's real quick to talk to them. Oh, your blood pressure's a little high. Oh, you're not feeling well. How are the symptoms? What's going on? Why do you think?
I think I have two reasons as to why. Number one, I think there's a time restraint. They don't have the time to talk about it, so they know if they do that, they're going to be opening up a lot more.
Yep.
The second thing is, I believe they don't want their patients to dislike them and to be offended by what they're saying, because, I mean, even though they come see me, there's things I say that I know offend my patients. Yeah, I know that. But, as empathetic as I can be, I don't sugarcoat things.
Right.
So sometimes it's coming from me. They need to hear it.
I think it's different coming from us because we are talking, they're coming for us because of the fact that they want to discuss weight, right? It's like if you were going to, your cardiologist, you're going to discuss heart issues, right? You're not going to talk to them about X, Y, or Z, right? Yes, you might talk about some obesity, things like that, but I agree. And I think time constraint's a big thing, especially in this day and age, right? Our patients have waited weeks, months to get in to see anybody, their primary, their specialists, their dentists, their whatever, and it's in a very limited time frame that they can't talk about everything. I agree with you. Do you think that do you think all the social media plays into a role of people and their fear of talking with obesity or anything like that?
Absolutely.
Yeah.
I mean, there's a lot of misinformation online that then makes people maybe feel badly about themselves, or they have false expectations or of what could happen, how successful they could be, or not successful. I definitely hear, I've done X, Y, and Z, none of that's worked, or currently I'm doing this, and all the reviews online, but there is no magic pill. There's no magic diet, so to speak, and I hate that word. I never say diet.
I hate that word diet. It has a really negative connotation to me. To me, personally, diet was always something growing up that when you got to a certain point, you were done with, or you would fall off, right? You would fall off the wagon. People will say, oh, I fell off the wagon and on my diet. To me, I think diet has a very negative connotation, and it should be, to me, it's always been a lifestyle change. I'm trying to make changes in my life to keep everything going, right?
Yes.
I'm not diet has a negative connotation to me.
No, well, and I agree, because that's just it. Like I'm on a diet currently. No, diets don't work. Lifestyle changes do work.
Right.
But over 40% of people in America are overweight or obese. So.
And it's growing exponentially.
Yeah, absolutely. I think we have over 40%, but the statistics go up dramatically, in 10 year. You know, I mean, it keeps doubling.
Yeah.
So on the course that we are now, and we're going to have 60% of the population, you know, struggling with obesity. So this has to change, you know, and the amount of specialty providers in this area is small, you know, and it takes a specialized person, just like it does taking, you know, an endocrinologist that's treating diabetes and cardiologist that's treating, you know, high blood pressure or anything to do with the heart. Obesity is a specialty, you know, and once people realize that that is the case, you know, hopefully more awareness, you know, so we have a lot of extra schooling and, you know, education. We educate ourselves, you know, on how to treat this properly to help our patients. But, you know, as far as the causes of obesity, you know, we talk about genetics. We talked about that the last time, you know, genetically.
Right, yeah, where we...
So there definitely is a higher risk of one becoming obese if you have a parent that also struggled with obesity. And it's almost like a 50%. I mean, if you have one parent who has had obesity, struggled with that, you know, your likelihood of becoming obese is high.
Yeah.
So it's something that as parents, if you know that's you, like let's say me, right? I worry about my kids. And it's something that as a parent, I want to make sure I'm educating them and I'm leading them down a healthy path because...
Right. You said it right, though, right there. Your healthy path, right? Because you know, and we've all, we hear it, and we've heard it as I've heard it, you know, where parents don't understand, and a lot there too, right? In the past, and they say, oh, if you just ate a salad, oh, you're pretty, but, you know, and so...
Right. No, I completely agree. And like you said earlier too, even, you know, with the pediatricians, you know, not always mentioning something either, you know, or we don't want to offend anybody by saying their child's overweight, or we don't want to offend, you know, maybe this teenage girl or something, which could then spiral. And I'm sensitive to that too. Like, I get that, but we have to address it. You know, so it's super
There's a way to step in and intervene without it being an attack.
Absolutely. And I also feel as though getting families to understand the importance of lifestyle changes, you know, that could be the first thing, is making sure there is exercise. They do have healthy foods at home.
And healthy foods don't always mean organic and
Right.
high price. That's the biggest thing. People get that in their mind. Oh, I can't eat healthy. We're talking about healthy, normal portion sizes.
That's right.
That's our. I think that's one of our biggest things here in America, in the United States, is our environmental factors. Right, is our portion sizes. We are a society of, we want it now, and we want the, what is that saying? The biggest bang for our buck, right? So you want the big combo meal because it's $15.99 as opposed to something smaller that might be just as pricey, right?
Right, for sure. And the other thing that is sad, it makes me upset, is when you have individual families who cannot afford.
Like a social determinant of health.
Yes, yeah. And there's just not those food banks. And if they have food banks, it's all the high bread and the, you know, the starchy things that they hand out. It's not the fresh fruits and vegetables. You know, those are things that should be available for individuals because, again, statistically, people who are on the lower, you know, socioeconomic class, you know, they have a higher rate of being overweight, you know, because they just don't have the resources available to them.
Right.
But, you know, as far as, you know, health risks are concerned, are when we discuss health risks, you said that you struggled with blood pressure.
Yeah, blood pressure. I struggled with sleep apnea, and I know and I shouldn't say struggled, because as you and I have discussed in the past amongst ourselves privately, when we see patients, we'll see patients that are type 2 diabetics, and now their blood sugar and things are, and A1C is under control, and their primary care provider has changed it in the chart so it has resolved.
Right.
My grandmother was one of those people that said, oh, I take metformin, so my blood sugar is normal, I no longer have diabetes.
Yes.
No.
Yes.
You are controlled. Could be diet controlled, your medication controlled. You still have diabetes. I still have high blood pressure.
Right.
Even though I may not take medication for it. I just now manage it, you know, with diet and lifestyle changes. Yes, I have sleep apnea currently. And after all the weight loss I've had, do I still wear my CPAP nightly? Yes. It's on the slowest possible settings. Hopefully it'll go away. Will I still have sleep apnea? Yes, it is now will just be lifestyle controlled because you can slip back into that very quickly.
Right. And it's funny, I'm smirking over here because there is someone that I work with that every time a patient gets below a BMI of 25, they wipe out the overweight or obesity diagnosis that I continue to add back in. And it's like we play this game because they get rid of it and I add it back. But I'm not getting rid of their high blood pressure diagnosis that they're still on blood pressure meds
They're
for.
controlled.
So I just click it back as still active and I giggle to myself and I'm like, I don't know what this game is we're playing, but I mean, I don't take away your diagnoses. Why are you taking away mine? You know?
Yeah.
So, but again, that's just the mindset. Like they
Right.
just don't get it.
But there are so many risks with obesity, right? Like we had talked about.
Yeah, so many risks. We have this, I have this chart in my room that's strategically placed. I know you've seen it behind me. And it's an overweight individual and it highlights not all, but multiple different diseases that are associated with obesity. But it is interesting that, you know, headaches and cataracts and, you know, acid reflux, high blood pressure, diabetes.
Yeah, polycystic ovarian syndrome.
Yes.
Many women suffer from that, as well as infertility issues because of being overweight.
Yep, absolutely. I know. I was just watching a show the other day, and they were talking about insulin resistance and how with polycystic ovary disease it has the infertility part for women, and then male infertility it has because when a male has insulin resistance, then their estrogen is higher. When females have PCOS, their testosterone is higher. So then that causes, you know, the infertility part of it. So controlling sugars is key in, you know, fertility.
Absolutely, and that's just on the iceberg, you know, because the tip of the iceberg, because there's gout related issues. You know, there are so many related issues that people don't realize that as providers that we deal with obesity, right? That affects people. So it's just like that very fine scale that tips it. You know?
Yeah, asthma. That's
Asthma,
another
yes,
one that I
yes.
see all the time that patients they have to be put on different asthma medications because, you know, and then they come in saying, well, it's just the weather right now and it's just really bad. But then I look back and I'm like, well, you've gained 30 pounds since the last time. So, and no one understands or that they just don't get that explanation as to obesity is a chronic inflammatory disease. It's going to make breathing worse, you know?
Absolutely.
But as far as, you know, prevention or treating obesity, it's just something that we definitely, just as a healthcare system, just people working in healthcare, we have to be more of an advocate for our patients.
Absolutely.
You know?
And in line with each other, you know?
Yeah, no, for sure. And I think, you know, trying to work on, you know, preventing things from getting worse. So making sure patients are following up. I mean, if we see that we're trending up in our weight, then maybe we should have, you know, a quicker follow-up and, you know, check on these labs before, you know, they have a BMI of over 40 and then they have all these other comorbidities associated with it, you know?
But I think one of the biggest things as providers and different things like that is we need to be realistic with patients, right? I think I think individuals have unrealistic expectations when it comes to weight loss and weight gain, right? I mean, for myself, I didn't become 425 overnight, and I didn't get down to 220 overnight. And, you know, so that, I think the expectations of things need to be more realistic. And so even with our prevention and management, you know, we need to have realistic expectations. We can't do everything all at once, right? We see people and we talk to patients and we say, oh, we need you to, we want you to lose weight, so quit drinking soda and quit eating fast food and quit smoking and blah, blah, blah. But we can't see that all happen overnight. It's progress. It's never going to be perfection. So we can't say stop smoking and then they're going to, some people have that oral fixation, right? So they turn to eating. We want to say, you know, stop drinking soda. Well, maybe we make that gradual. Are you drinking full, like we talked about, do we drink full sugar sodas and now we move to more of a diet soda and then a sparkling water, we actually take that away. And I think that's what we need to realize in ourselves is we need to stop beating ourselves up because it's not perfect.
Yeah, no, for sure. And I always say, you know, if you are drinking 3 to 4 sodas a day, let's cut it down by half. Let's start that way, you know, because drinking your calories is definitely one way to help speed up the weight loss process. But again, it's making healthy choices, you know, so which is definitely something that a lot of patients, you know, like you said, they're told so many things all at once, and then it gets overwhelming, and they don't know where to start.
Where to turn to or where to start, right? And there are a lot of simple support places and you know, resources just right on the internet, right? Lots of things. World Health Organization is one place. Mike was nice enough to put up something for us there.
It's from the Mayo Clinic.
Screen. From the Mayo Clinic. Oh, thank you.
Oh yeah, that's good.
Yeah, talks about some of the complications. But, you know, right on there, I'm sure if you click on the Mayo Clinic, there's lots of different resources. I know if you literally look up Healthy People 20, is it now it says Healthy People 2023, there's a whole list of things online that says all about different places you can go to, different resources. I know, Amy, you have some.
Yeah, we move. It's a MOVE program through the Veterans Association or the VA. Yeah, I think move.va.gov. Oh, there we go. Yeah, U.S. Department of Veteran Affairs. Yeah, that has a great resource. It's free, and it's a federal site, so anyone can use that. Also, Rethink Obesity, the CDC.gov / obesity. And the Obesity Society is another really good one. And what's good about all of these is they're easy to read. So they're
there
great.
It is. It's Healthy People 2030. Yep.
So
Perfect.
they're good resources for people with no medical background, just giving them tips on, you know, how to help, because that's sometimes all individuals needs is just a little bit, you know, to read up on. So they can, even if they don't want to ask questions to their doctor, you know, they're embarrassed about it, they see their weight going up, there's resources out there that can help people start.
Yeah.
You know, for sure. So I think really the bottom line is awareness and helping patients understand that it's nothing to be embarrassed about.
Right.
And you know, that's why there's individuals like us in this area of work, because we are so passionate about it.
But also, the individual needs to just also have their own accountability, right? Step up and decide they're going to make that discussion. Make your primary care provider discuss why what's going on with the weight. Make your OBGYN discuss why, how your infertility or what you're struggling with maybe is affected by your weight. Make these people discuss it with you.
That's right, absolutely.
Be your own advocate.
Right.
We're here to help you as much as we can. You and I as weight loss providers, because we're a specialty, right? But the first thing is you have to, like I tell all my patients, you made that first step to come here. You were your own advocate. You didn't have to. Your doctor said, here's a referral. You didn't have to come to see me. You chose to, and that's the best thing.
Yeah, no, absolutely. I completely agree. And I'm always giving them kudos for just coming in the door, because I know it's difficult. So, Yeah, I think the more awareness we have with this, you know, the better it's going to be. It's obviously taking time, but it's definitely gotten better from, you know, 10 years ago. So
Right, because people realize that obesity is a chronic disease. We just need to make sure everybody realizes that.
yeah, no, for sure. Yeah, thanks, Mike, for putting up the resources for us, and you know, for another episode of The Heavy Truth. I hope you all learned something and have something to take away from this.
Yeah. Even if you think that we both knew nothing, you just want to comment about that, that's great too. That means you listened. Thanks.
That's right. All right, until next time.
See you soon.
See you soon.
Bye-bye.